Welcome to the Healthcare Workers and Integrative Professionals group. And I welcome you for this brief meditation, which I hope can continue to nourish you as many times as you're able to revisit it this month, and hope you can join us next month. Octavia Rahim, when I allow myself space to rest and reflect, wisdom rises within me. So, and next slide, Danny. So we'll be doing a meditation this morning, which is touching on a framework which really emerged from this group over the last 9 years. And some of the wisdom that has emerged in this group is the importance of community and connecting with each other authentically, having a chance in our busy lives when there's a lot of care and service and schedule with clients and patients, a chance to connect as peers and through community for the many ways that we're healed and heal ourselves when we're in relationship with others. This framework emerged from, came on a whiteboard. We used to meet in person for the many years before we went completely virtual. And on the whiteboard, we just drew an image of what was coming up every month over and over again. So community emerged. And the other corner of the triangle was emotional health. Being present and allowing yourself to acknowledge and digest your experience, or you are. There's so much attention to detail, to caring and attending for others. This concept that emotional health, whether or not it's boundaries and healthy start times and end times for work, how to communicate needs, the importance of emotional health and being present in our bodies, in our breath, learning how to be emotionally healthy as healthcare providers, which is often missed in our training as an emphasis. Finally, mindset, and that's what we'll be focusing on in our meditation today. So what does it mean to be in a paradigm, a holistic healing paradigm where it's not just about a healing environment for others? This is our day-to-day work. We spend a lot of time at work as a healthcare provider, integrated professional. How can I be in tune with myself? And how can I be present? And how can I bring a certain sense of giving and receiving for my own health as I go through my day in a truly integrative paradigm? What is an integrative paradigm? What is the mindset that we seek to cultivate? So we can just go on to the next slide and formally begin our meditation today. Finding your feet on the floor. So if you're sitting in a chair, uncrossing your legs and finding one foot and the other foot firmly on the ground, and also seeing if you can establish or align with an aligned spine with your head over your shoulders, over your hips. In mindfulness meditation, we talk about the mountain with the feet stable on the floor and the seat in the chair, just so that we can be embodied and grounded and connected through gravity to the earth, while all the weather happens, the internal weather and the external weather. So I'll encourage you to have your hands in your lap. I'm going to turn my palms face up and just see if I can relax my fingers, relax my thumb. See if I can sense the presence of the air on my palms as I feel that mountain of support, feet, seat. And just notice if you're breathing. So this meeting is breathing room. This meditation is intended to source and have you connect with the source of support in you. supporting each of us to transition fully into the mindset and into the way of being and the way of proceeding in our day, which is integrative, which does include us in our attention. And also, it's really an integrative way to see ourselves and our patients, not as someone to fix. Our patient is someone to be with, listen to, empower, understand, and to travel with as a partner in whatever integrative field we practice. Releasing any sense of burden and work and being in the mystery and the discovery and the partnership. So if you have not closed your eyes or lowered your gaze, I'll encourage you to gently close your eyes. And notice if you're breathing. And you're safe in this moment to breathe and pause. Safe to notice what might be happening inside. Any sensations, anything you feel in your body, could be pleasant. Just feeling the rise and fall of your breath and noticing any other sensations as well. Just noticing and allowing whatever it is you're noticing and feeling, attending to in your body. The level of energy, ability to listen to instructions, noticing if your mind is in a couple places at once, and seeing if you can gather yourself here, mind and body in the same place. This present moment is where we learn, it's where we feel, it's where we can grow. It's where we can relax. It's where we heal. So today's meditation is focused on cultivating mindset. The mindset of a healing, growth-centered mindset. There are no failures, just the opportunity to be in a learning mode, in an attitude, and a way of responding that is growth and learning centered. That is the opportunity. It's not a world of good and bad, and we like this result, we don't like that result. I have this problem in my body, but rather inquiry and open to the clues of the mystery. So in my practice, I like to introduce abnormal laugh values as these are clues to the mystery, things that we can work with, welcome information. Information from our body and ourselves. It's not something to be scared of. And we can also feel scared. So to cultivate a mindset, an integrative practice mindset, I'm going to introduce 3 different areas, and I'll invite you to experience them with me. Breathing, feeling your body and your ground. The first is a surrender and an acceptance of this moment. Seeing if you can let yourself be and let things be just for a few moments together. Just letting yourself sit here. Letting go. And allowing this space to be there when we meet our client, when we meet our patient. Hello. Just a little gap. Allowing. Welcoming. Letting them be there just as they are. Before we immediately dive in and share and teach, explain, help. This concept of surrender to this moment. Acceptance of ourselves. We don't know everything, and we're not done with our training. We are here, and we are with our client or patient and their family and their community. And the second aspect of mindset to cultivate today is one of the concept of restraint. So in this moment, seeing if you can harness and practice throughout this next month the idea of restraining yourself. Perhaps you're in a meeting or you're in a client visit and there's one more thing, and it's okay to not go there. Perhaps to acknowledge it or revisit it later. But the concept of attending to what's important and then restraint, meaning sometimes we don't need to say something. We don't need to do something. We don't need to act. And this permission and the power that comes and the energy conservation that comes from consciously, with the right intention, restraining ourselves. Let's just sit in silence for a few moments with that offering restraint. And the final and third thing for our meditation this morning, as we cultivate a mindset of healing for ourselves and healing for our patients, our clients. An attitude of gratitude. If we are breathing and if they are breathing, there is more right with us and them than there is wrong. There's much more right. Sense of gratitude for who we are, what we have, any relationships and connections that we feel grateful for, any people, pets in our lives, feeling gratitude for those people. Those beings in our lives who welcome us or who are traveling with us, doing the best they can. And a sense of gratitude for an integrative mindset is truly freeing. It releases us from that sense of burden that we're on the hook to get this right and to know it and to fix it and to take care of it. Releases us from that burden of the idea of a clinical failure or a lack of improvement or even death as a failure from us, by us. Instead, seeing ourselves as part of a continuum of awareness, connection with the body, understanding the messages and the signals, the symptoms, the labs that are expressions of the body. And that we're part of a mystery. It's not our responsibility to do it. We are safe to offer our gifts, offer our training, our perspective, our explanations, to empower our clients, and to seek to understand together and to travel the healing journey together, but releasing the pressure. Doing our part and having integrity. But there's such a pressure to do it well, to do it right, and to know it all. And we don't. We can offer who we are, and we can be present, and we can be freed up in this integrative approach to ourselves, to life, and to our practice. So I'd like to sit for a full minute, just in silence, and I encourage each of us to practice a receptive state. So just see if you can cultivate that non-doing and that pause. If you're listening to this meditation later, you can also literally press pause on the recording and extend that receptive silent time for yourself as long as you would like to, different amounts of time on different occasions when you might listen to this meditation. Practicing being receptive, listening, being, not surging forward, but taking it easy, receiving. And we'll practice that together. And coming back to your breath, coming back to your body. And thank you so much for joining us today, whether or not it's live or whether or not it's recording. And you are invited to return. Our next upcoming healthcare provider and integrated professional meetings are on the first of the month at 8 o'clock in the morning. And each of them is intended to source support for you and for your full transition to an integrative and functional medicine approach. Thank you so much for joining, and have a wonderful day, afternoon, or evening. Thank you.